Hello everyone, I am Anand. I am a psychologist and psychotherapist. In this video, I am trying to explain a cognitive behavior therapy procedure called exposure and response prevention, which is now globally used as an evidence-based therapy to manage the symptoms of obsessive-compulsive disorder. At the end of this video, there is a step-by-step guide which enables any OCD patient to do ERP himself at home. So, watch the video completely. I am moving quickly into the topic, but watch completely and subscribe my channel. Also, do not forget to click the bell icon for updates. With exposure and response prevention, a mental health professional trained in CBT conducts a series of controlled ERP sessions with the patient who has OCD. During these sessions, the therapist gradually exposes the person to the situations that trigger his or her obsessions and compulsions. Over time, the person learns to respond differently to these triggers, leading to a decrease in the frequency of compulsions and the intensity of obsessions. OCD symptoms often become so mild that they are easily ignored. Sometimes they disappear. The first step in ERP is for the person with OCD to provide the therapist with a detailed description of his or her obsessions and compulsions, which are then ranked from least bothersome to the most difficult. Then, beginning the easiest symptoms, the therapist designs exposure or challenges that put the individual in situations that trigger obsessions. During these exposures, the person avoids performing compulsive behaviors called response prevention for increasingly longer periods of time. Through repeated exposures, the individuals with OCD realize that when they avoid performing compulsions, their anxiety increases temporarily, peaks and then decreases. In cases where creating the actual situation that triggers a compulsion is impossible, therapists can use imagined exposures, visualizations and recordings that can effectively increase anxiety levels for ERP exercises. When therapeutic exposures are repeated over time, the associated anxiety decreases until it is barely noticeable or actually fades entirely. The person then takes on more challenging exposures until they too become manageable. Effective ERP leads to habituation, which means people learn that nothing bad happens when they stop performing these rituals. If you have an obsessive fear of germs, for example, a therapist conducting ERP therapy may work with you to encourage you to touch the top of a desk which you believe is contaminated and then wait longer and longer periods of time to wash your hands. Over time, this gradual exposure and the delayed response would help you learn to respond differently to the fear or thoughts about germs, which in turn would actually lead to a decrease in the frequency and intensity of the obsession. Usually, ERP therapy is carried out under the supervision of a qualified therapist because of the anxiety spikes which the client never wants when alone. But through this video, I request you not to surrender, get motivated. Anxiety and anxiety symptoms are just your body's natural defense mechanism, and do not worry or fear these symptoms. Step 1 of ERP is write down all the exposure or compulsions you may have. The exposure in ERP refers to exposing yourself to the thoughts, images, objects and situations that make you anxious and or start your obsessions, while the response prevention part of ERP refers to making a choice not to do a compulsive behavior once the anxiety or obsession have been triggered. As step number 2, from the list of exposures and compulsions which you have made, select one exposure and compulsion which you are having least experience of anxiety. Your biggest worry may be germs contamination, but there should be your least worried compulsion. Choose it to start your ERP experiment. Step 3. As mentioned earlier, do not worry too much about anxiety and its symptoms. They are just your body's natural response to the threat and is a defense mechanism. So be brave to face the mild anxiety symptoms which may arise with the exposure. In step number 4, for example, if your least anxiety provoking exposure is repeated checking of door lock on leaving to office, select this exposure because it will be the least anxiety provoking. You do not have much worry about the anxiety the exposure may provide or provoke, even though you do not do the compulsive responses. In step number 5, the first week, sit in a quiet place, take deep breath, close your eyes for 10 minutes. Imagine that you are leaving the house after locking the door. When you reach the gate, you have compulsive thinking that you have to check the door lock once again. But you are cool enough to overcome the compulsion and just ignores it. Imagine this scene at least thrice during one relaxation period. Repeat the same breathing and imagining exercise twice or thrice daily for a week. As step number 6, your mind has now experienced, because of that imaging techniques, now experienced there is no danger even if you don't check the door lock again and again. So you will face the reality now. Be brave because, as I told you, anxiety symptoms are just reactions. On leaving home, lock the door, lock, and as usual go to the office. Ignore whatever the compulsive anxiety symptoms that may arise. Usually by now, due to the imaging exercise, the anxiety symptoms may not appear at all. Even if they appear, they should be much milder. Just ignore the mild anxiety symptoms and walk away from your home. The more you are away from home, the more your symptoms will subside. As step number 7, repeat the previous steps every day. Ignore the anxiety symptoms every day. This way, you are actually dissociating the connections between the exposure and the trigger. Once the connection is removed, the exposure will not trigger the response and anxiety. After a week's repeated training on the same exposure, you will never experience this door lock related checking compulsive behavior. In the same way, you can go to the next least anxiety provoking exposure and work on that in the same series of steps as I mentioned before. Obsessive-compulsive disorder is not curable, but it is manageable, and management translates as cure. There are many other treatment methods like CBT, cognitive therapy, systemic desensitization, which can also be used to manage OCD symptoms. A good therapist selects the therapy method according to the requirement of the patient and the need of the hour. Do not shy away to work with your therapist because ERP is best administered by a trained and experienced therapist. Thank you for watching this video. Do not forget to subscribe my channel. Also, please click the bell icon for updates. Thank you.